I'm Shane Daniel. I'm a PA here at HMG. I've been asked to kind of go over some of the virtual visits or televisits. They have many names that we do here at HMG. First of all, we'll talk about kind of what kind of visits we can do with those. And honestly, you can do virtually any type of visit you can think of this way. Simple medication refills, behavioral health stuff, acute visits, being sick, minor injuries, etc. So that being said, have several different modalities. Probably the most common one we use is something called doxy.me. It's pretty simple. Whenever you call the front to schedule an appointment, if you're offered a doxy or you ask for a doxy visit, they will ask you for your email. They'll send you an email link that is simple as opening your email, clicking on the link, and it will take you directly to the site where you need to go. It's pretty simple prompts too. It will ask you, your name. Basically, you set up a free account. It takes about a minute and a half. And then it will automatically, since you clicked on that link, put you in what's called my virtual waiting room. So when I'm signed in, I will see you in my virtual waiting room. I can open it, see your name, and we can go from there. So once they're logged in, obviously this is my side of things, but the patient side looks very, very similar, if not exactly the same. It will show my queue here, which is my virtual waiting room, and you can see that we have a patient in there already, and it's as simple as literally I just kind of start the call. Hello, Danielle.
Hi.
How are you?
Good. How are you?
Doing well. So you can see, she can see me, I can see her very well, and we'll go from there. So in getting back to some of the visits that you can do virtually, again, it's, I hate to keep using the word virtually, but virtually you can do any type of visit you can think of. We get a lot of folks, for instance, that just, they need a medication refill. They're stable on their blood pressure medicine, they're feeling fine, they just need a refill. Obviously, if we could do that this way, that would be much better than risking exposure, having them come into the office just to get a refill on their blood pressure medicine. Again, you got somebody that maybe twisted their ankle out in the yard and, oh, it's swollen and hurts, it's bruised, it's difficult to weight bear, but I can somewhat. Again, this is a good tool. It's obviously I can't examine their ankle in person, but a good history via this way, maybe getting to see it via the camera can determine, well, I think you might have a grade 2 sprain, we need to do this, versus we need some imaging modalities, we need to get you in here and take a peek, that kind of thing. Even upper respiratory tract infections. Granted, we're in a pandemic, so I know that everybody typically is or wanting to get COVID tested. Again, this is a very good tool to kind of triage and see how sick somebody really is. Most people have thermometers in their homes. I believe it or not, most of my patients even have pulse oximeters at home. They can check their pulse oxes, their temperatures, etc., and give that to me this way. And there's a lot to be said about just seeing somebody, whether it's on a computer or not. You can pretty well tell someone's distressed and breathing hard, even via a computer. So again, you can do almost anything this way, or at least use it as a triaging tool, which is really cool. And another way that I've done these virtual visits is not only with with Doxy, but also something called Doximity, which is secure as well. I tend to use this more for the folks. I'm not really good with email. I don't have an email account, or it's been so long since I've been on there. I'm not good at opening this and then clicking this and opening that. What Doximity is, and I can show you here on my phone, is I will log into it, and you can see here it has the office number. That is what the patient sees when I call them. It will show up as the office number, not my cell phone number. And I have the option of video calling as well. So if somebody has an iPhone or a Droid that has a camera, I will hit video call. It will send them a text. They will open the text, click the text link, and it does everything for them. It's kind of like doing Skype or FaceTime. So that's another great option. So to summarize, with today's technology, it's pretty amazing that we can do many different types of visits virtually. And obviously, if you ever had a question of if it's something that needs to be necessarily seen in person versus virtual, we'd be more than happy to assist. You could call the front office and speak to the staff there, or ask to speak to a nurse, and we could assist you in that way. But it's relatively simple. If you want to be seen or are interested in a virtual visit, all you'd have to do is call the front just like you normally would to schedule an appointment, and they will give you the options and set you up, whether it be via doxy.me, where they'll send you instructions via an email that you'll open immediately, basically, or via the Doximity app. It's pretty simple.